Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant.
And I'm your co-host, Dr. Karen Bodnar. I am a pediatric hospitalist at Inova Children's Hospital and an assistant professor of pediatrics at Virginia Commonwealth University.
I'm also a board-certified lactation consultant.
This podcast is produced by the Institute for the Advancement of Breastfeeding and Lactation Education and is co-sponsored by the Academy of Breastfeeding Medicine. Hi, Karen. How are you?
I am really good. How are you doing?
Good. So we have I think we have some fun short articles to review today that are relatively new. I think I'll start with one of my topics first. So the first article I want to talk about is entitled "The Effect of Different Tube Feeding Methods on the Delivery of Docosahexaenoic Acid and Arachidonic Acid," which are also known as DHA and AA. And this was published in the Journal of Parenteral and Enteral Nutrition in September 2018. And this was done in Italy with the authors Martini, Assetti, Farini, and several others. So the authors talk about in their background that docosahexaenoic acid and arachidonic acid, again, we call them DHA and AA, these are essential fatty acids. And so they're really important for the development of visual and brain development in premature infants. And we as humans don't make these, except we do make them to some extent in our breast milk, but we don't make them for ourselves. So we need to get them in our diet. So for these babies, they need to get them through breast milk. And they would have gotten them through in utero had these babies stayed in utero for the requisite amount of time. So mothers who ingest these in their diet will have higher levels of DHA and AA in their breast milk, and usually they need to eat fish or seafood in order to have adequate DHA and AA. And so there have been many articles written about the importance of mothers having adequate DHA and AA, and even milk banks have documented the differences in the amount of DHA in the breast milk in their donors, and you can see that in parts of the country where there's higher amounts of seafood, like the coasts, there's more DHA in the milk than in the Midwest, for example. And so in reality, when babies are in utero, they get their highest transfer of these fatty acids from the placenta to the fetus in the third trimester. So that's why these babies are hit so hard, because they're ex utero in the third trimester. And so what we need to do is make sure that these babies are getting enough DHA and AA. And in fact, we did one clinical question of the week through the Institute for the Advancement of Breastfeeding and Lactation Education, IABL, on the recommendation by Bert Koletzko, who's a human milk researcher from Europe. He recommended 3 grams of tuna oil a day for all mothers who have babies who are preemies to get adequate DHA in their breast milk. So anyway, so we know that premature infants under 34 weeks are very often tube fed to some extent. And the concern by these researchers is that the fatty acids will tend to separate out from the watery portions of the milk, and the fat will adhere to the tubing. So I think we've known for years that there's some fat loss when babies are tube fed. And they wanted to know which type of tube feeding method would lose the least amount of the fatty acids specifically. So they simulated 51 feedings, either using fresh mother's milk or pasteurized donor human milk. And what they did is they measured the DHA and the AA with like before and after. So they measured it with bolus feeding over 4 minutes. So then the food just like rushes into the baby over 4 minutes. And then horizontal continuous feeding over 3 hours. So the feeding is gradually delivered to the baby over 3 hours with the tube, and the tubing is held horizontally. And then they also looked at what happens to DHA if the tubing is held at 45 degrees angled. And then again, it's this continuous feeding over 3 hours. So what they found is that the bolus feeding lost the least amount of fatty acids, and there really wasn't any difference before and after with the bolus feeding, which kind of makes sense because there's not a lot of time for that milk to be adhering to the lining of the tubing. And also I think maybe the force of like the weight of the feeding is like pushing the fatty acids maybe through the tubing.
Sure, but the problem with that is that the reason that they do continuous feedings often is because the baby can't tolerate the
Right.
gavage without getting,
Throwing up.
spitting up or having a residual or other,
Right.
they're just not able to handle it.
Right. And so then they found in the continuous feeding, both for the angled and the horizontal feeding, that there was a lot more DHA in the second half of the feeding than the first half. So already the fat is hanging back. And so, so I guess one important thing is that if they interrupt the feeding, if they put a bunch of milk in there and they figure, okay, we're just going to do this continuous feeding, but we probably won't give them like the last third of that milk. I don't know if that really happens. They're going to lose a lot of the DHA and AA.
So then my question, you're probably going to say this in a second, is like part of the thought with that is that when the first milk is going through the tube, it's adhering to the tube and then it sort of gets coated and the remainder, goes through without as much loss. And so is there some benefit to priming the tube for some period of time before they start giving the milk to the baby, if you have extra milk?
Well, that's a really good idea. That's a really good thought. It's kind of like I was always taught, if you wet your hair before you go swimming with
to protect it from the chlorine,
then the chlorinated water can't cling because it's saturated. So that makes sense. But no, they actually didn't study that, which I think is brilliant, Karen. But what they found is that there was very little fatty acid loss in the angled continuous feeding. So most of the fat loss occurred when the continuous feeding was horizontal. And so they said that there was a 69% loss of fatty acids with horizontal tube feeding. So they recommended that either bolus feeding or continuous feeding at a 45-degree angle to make sure they're getting enough DHA and AA.
Well, that's cool.
Yeah, but I think you should market your idea of priming.
Oh, it wasn't my idea.
Oh,
we've discussed it previously in NICU rounds. So I think that it's an idea that has been thought of before. Whether or not it's been done anywhere, I don't know, but
should find out. Yeah, we're not neonatologists, so
no, thank goodness.
Yeah.
I'm grateful for all of you out there who are neonatologists, so that I don't have to. All right, so I'm going to talk about an article that actually is just mind-blowing to me, which is about intranasal breast milk for premature infants with severe intraventricular hemorrhage, an observation, by Titus Keller and Frederic Colbert. It was published in November of 2018 in the European Journal of Pediatrics. And they start out by, reminding us that preterm infants less than 1,500 grams, which are termed very low birth weight, are a group with significant morbidity and mortality. Severe intraventricular hemorrhage remains a complication with limited therapeutic options. And this study really grew out of trying to help infants with this very difficult problem where there aren't a lot of options. They talk a lot, and if you are interested in the subject, I really recommend grabbing the article because there's a lot of background in the studies behind this, and I'm not going to go into, but erythropoietin has been reported to have positive effects on neurological outcome, sort of in this scenario, and there are animal studies that support the hypothesis that intranasal application of neuroprotective substances, such as epidermal growth factor, could be a future therapeutic approach. However, there's a lack of data from human studies with intranasal treatment approaches. And while it's known that breastfeeding is associated with improved performance on intelligence tests years later, the mechanism's not well understood. And the impact of breastfeeding on intraventricular hemorrhage, which I'm going to call IVH going forward, is not well investigated. It's known that breast milk is rich in growth factors, neurotrophins, and immune cells, And exposure of the nasopharyngeal mucosa of healthy newborns to their mother's own milk occurs physiologically during breastfeeding. But just like you were saying, in very low birth weight infants in the neonatal intensive care unit, this contact is usually bypassed because they're being fed via tube.
Mm-hmm.
And so the role of breast milk exposure for infants on the CNS has not been investigated. So this study is a retrospective case control of cerebral ultrasounds of infants who had severe intraventricular hemorrhage, and they were all very low birth weight infants, to examine the result of exposure to intranasal breast milk. So this happened because in July of 2012, one very low birth weight infant with severe IVH started receiving regular drops of fresh milk from her mother intranasally out of compassionate use. Essentially, this was a baby who was born at 26 weeks after preterm labor. And they had pretty good course in the beginning, good APGAR scores and a normal umbilical artery pH, no signs of sepsis, no need for transfusion. But on day of life 3, the cerebral ultrasound, which is done routinely, showed bilateral IVH. On the right, it was grade 2, and on the left, grade 3 out of 4, with 4 being the worst. And intraparenchymal infarction on the left side.
Mm.
And when the neonatologist was explaining the diagnosis to the parents and the possible consequences, as well as the limited therapeutic options, they were asked if there were any other measures beyond standard therapy that could be taken to enhance the possible beneficial effect on brain development. And the additional intranasal application of some drops of breast milk was proposed by the attending neonatologist. They must have been familiar with some of this other background that I was not.
Yeah.
The idea was to possibly increase exposure of the brain to neurotrophins and stem cells in breast milk via the nasal route. And the parents consented under a compassionate use. So intranasal breast milk is commonly used for congestion in neonates, and there was no safety concern. And this baby was being treated with a respiratory support using CPAP. And so the milk was given 3 times a day during the regular switching of the nasal CPAP device. 1 drop of the baby's own mother's milk was given 3 times a day and continued for 10 weeks until discharge. The IVH resolved over a period of 7 weeks, and the neurological evaluation at discharge was good. This intriguingly good course contributed to the application of the same measure in 15 other very low birth weight infants with severe IVH between July of 2012 and August of 2014 with informed consent. So standard cerebral ultrasound diagnostic was performed daily until day 3, and then weekly. After 4 weeks, ultrasound was performed every other week, and then the cerebral ultrasound images were analyzed by a pediatric radiologist blinded to exposure of the intranasal breast milk, as well as the date of the scans. The authors presented a retrospective summary of 31 infants where they had matched all the cases with controls. And all the infants were breastfed. 16 of them additionally had the drops of breast milk for at least 28 days. The main outcome was the measurable severity of chorencephalic defects before discharge. And the severity of the hemorrhage findings in the first days was similar in both groups, with them being slightly worse in the group that had the breast milk given intranasally. However, there was a decrease in the incidence of these defects, 21% versus 60% in the babies that weren't treated. There was a decrease in the treated babies of progressive ventricular dilation from 90% to 70%, and the babies who were treated had less surgery for post-hemorrhagic hydrocephalus, only 50% versus 67%.
Wow.
They found that the severest findings of white matter damage were 2.8 times more often in the control group than the intervention group, although there was such a small number of babies that statistical significance was not found. So the authors hypothesized that early intranasal application of breast milk could have a beneficial effect on the neurodevelopment in preterm infants, and further controlled investigation is needed. I find this just to be absolutely amazing, that they would have thought of this, and that these effects were seen. I will say there's a lot more in the article, but the one thing I did want to mention was they pointed out that the uniqueness of the olfactory neurons exposed to the external environment as an entrance for the brain is not selective for neurotrophins or stem cells, and pathogens, like some amoeba, can also use the nasal route to the brain. And so, this olfactory route for neuroinvasion needs critical attention. They didn't specifically talk about CMV, but I thought that was really interesting, specifically since this article came out of Europe, where I think in general NICUs are more concerned about CMV for these particularly small babies in fresh breast milk. So maybe, they had tested these moms and they were CMV negative. They didn't specifically comment.
Yeah, or they froze the milk or something like that.
No, that was all given within 2 hours of expression, fresh.
Yeah, that makes more sense. Yeah.
So, because they're trying to keep those stem cells alive. So I think, this does seem like it would be worthy of further investigation, and it's just fascinating.
That'd be amazing also to give it to adults with stroke and, other people with meningitis.
They've talked a little bit about that in here as well. Oops,
wow.
Sorry.
Yeah, interesting, and so the other thing, though, is that even though babies are tube fed, they oftentimes do reflux into their nasal, up into the, posterior nasopharynx. And so,
well, that goes to this thing we just mentioned about whether or not they're continuous or gavage fed, because they're in general trying to prevent them from having that
refluxing
in the beginning, especially, if they're intubated or they're on CPAP, but there may be fortifiers. It's very complicated.
So this is another reason why we can tell mothers or families when the babies, the term babies, are spitting up and it's like coming out of the nose and it looks like The Exorcist, and they're like, oh my God, it came out of the nose. Like, oh, that's so good for the brain development,
Oh, that's really funny, because I have told them for years, no, that's all of that immunoglobulin coating the inside of their nose and protecting them from viruses so they won't get sick. But now I can also say they're gonna grow their brain.
Smarter. Yeah, that's really great. Okay, I love that. So, okay, more to come on that. We're going to follow that one really closely. Okay, so another article is entitled "Maternal Placentophagy as a Possible Cause of Breast Budding and Vaginal Bleeding in a Breastfed 3-Month-Old." And this was a case report that was published in the Journal of Pediatric and Adolescent Gynecology in September 2018. By a couple authors, Stambo, Hernandez, and Gunn, and others. So basically, placentophagy is also known as taking placenta capsules. It's the practice of ingesting the placenta after birth. And so the most common way that I have seen in our community people doing this is to sign up with a service that will take the placenta after birth, dry it in the oven over time, and then turn that dried placenta into capsules that the mothers will swallow. And the reason that women choose to do this is to prevent postpartum depression, because they feel, the idea is that when a woman delivers, she's dumping all this hormone that the placenta was making. So she felt great during pregnancy, and then postpartum, there's this big hormonal switch, and that it's the change in those hormones that increases the risk of the baby blues and postpartum depression. So the idea is that you're just taking yourself down more slowly with those hormones by taking the capsules. And then the capsules are thought to reduce postpartum bleeding to increase milk supply and to get added iron, since the placenta is so high in iron. Although there's really no evidence that eating the placenta does any of these things. And there's some conflicting opinions on the issue as to whether or not there ever really has been a human culture on the face of our earth that has actually historically ingested placenta. Many authors and anthropologists indicate that there is no evidence for such cultures, and some people say that there is. So we don't know for sure. So anyway, these authors present a case of a 3-month-old who had breastbudding and vaginal bleeding thought to be due to placenta ingestion. So what happened is that this was a baby that was born to a first-time mom. She didn't have any prenatal problems, but when the baby was born, the baby had ambiguous genitalia. The baby had a 14-millimeter phallic structure and a perineal opening and labial scrotal folds that were fused in the midline. So the baby had features that were a little bit male and a little bit female, and she was identified to have congenital adrenal hyperplasia. So she was put on hydrocortisone and fludrocortisone and salt replacement to correct for her deficiencies. And so she was followed by the endocrinologist, and the baby was doing fine by 1 month of age. And then at 3 months, the mother called because the baby for 2 weeks had some intermittent vaginal bleeding. And so when they saw her, they found that the baby's breasts were already a Tanner 2, which is like those, those early breast changes that like an 8, 9, 10-year-old would have, where they start to wear bras. The baby had breast budding, but the labia had not changed, and there wasn't any hair down below. The baby had some vaginal bleeding. So the mother did tell them that she was taking placenta capsules, and the endocrinologist thought that the changes were probably from the estrogen in the placenta capsules. They recommended some blood tests for the baby and a pelvic ultrasound to make sure there's not something like an ovarian tumor, but the mother decided not to pursue those and agreed to stop the placenta capsules. The breasts eventually went down in size and the vaginal bleeding stopped. And so nothing else was done, but the case report sort of made the conclusion that this was probably from taking the placenta capsules. And then the authors just state as a side note that the Center for Disease Control in the United States recommends not ingesting the placenta because there was a case report of late onset group B strep sepsis in an infant from the ingestion of the placenta. Mm. So I would say that in my community, I haven't noticed how all these babies have really sort of profound breast buds when they're born, and they can look and even have a little bit of milk secretion from their breasts. And I just tell, my staff knows, tell people, look, that's normal, don't worry about it. And the vaginal bleeding, the little bit of spotting and bleeding in that first week is normal, with lots of mucousy vaginal discharge and labial, swelling is just normal. I haven't seen this happen, but I think it's just a reminder for all of us, if we do see a baby that has really persistent enlarged breasts with drainage and maybe some bleeding after those first, 5 days or whatever, to think about whether or not mom is taking placenta capsules.
Yeah, it's so fascinating. And I think a lot of times, I don't know that it's intentional, but people don't always mention the things that they're taking that are not from the pharmacy.
Right.
Right. So be that, herbal or this, sometimes it doesn't come out on the history if we don't ask specifically. So it's probably a really important thing for me to remember to always ask.
Yeah. Well, I would say the most impactful thing that I see with placenta capsules is lack of milk, is very low milk supply from taking the placenta. And, there's probably variable absorption of those hormones from the capsules, but, obviously for the milk to come in, so to speak, which is secretory activation, the placenta has to go away to drop those progesterone levels. And when you take placenta, you're taking in the hormones that you're trying to get rid of in order to establish your milk supply. So
and you're probably also having your estrogen level high, which is going to
Exactly.
suppress your milk supply as well.
Exactly, right, both. And so I've had mothers who have had a fine milk supply with their first take placenta the next time because they had postpartum depression before, and someone said, why don't you try this? And so then they feel the milk starting to come in, like on day 2 or whatever, and they're thinking, oh, this is all good, my milk's coming in. And then their placenta comes back all nice and dried and the capsules, and they start taking that, and suddenly the milk goes away. And my theory has always been, if the low milk supply is due to the placenta capsules, after stopping the placenta capsules, it should take 6 or 8 weeks for the milk supply to come back up to sufficiency, because you're basically in a relactation situation. And that's basically what I find clinically. My prediction about that tends to be pretty accurate. Many women do get their supplies back. And I should say that not everyone who takes placenta capsules has this problem. It probably depends on how much hormone they're actually absorbing and
how much is left, depending on how it was processed.
Exactly.
When people ask me about this or any herbal, I say, there are certainly some herbal supplements on the market that go through, they're tested and we have more confidence in what they are, but they're not regulated in the way that, pharmaceutical medications are. And so I'm always like, do we really even know this was your placenta that came back to you? I find that very distressing.
Gosh, that's a scary thought. Let's hope that that's not the case. But
I'm just saying the regulatory system is not there. So
yeah, it's true. All right. Well, I have one other article, and this is also really super interesting. It's entitled "A Randomized Clinical Trial Reducing the Intake of Dietary FODMAPs of Breastfeeding Mothers is Associated with Greater Improvement of the Symptoms of Infantile Colic Than for a Typical Diet." So this is an article that was published in the Elementary Pharmacology and Therapeutics Journal in September 2018, and it was done in Australia by a number of authors, Lacavo, Craig, Yelland, and others. So you and I know, being in breastfeeding medicine for a long time, that mothers will complain that certain foods will cause gas in their babies. Like, particularly, I always think of broccoli and cauliflower and cabbage. And these authors were interested to find out whether colic could be improved by changing mom's diet. So first, they made sure that they were dealing with actual colic in the subject that they had in their study. So we know that colic is defined by the Wessel's criteria, which is crying that lasts for more than 3 hours a day, more than 3 days a week, and for at least 3 weeks. And the way first of all, were you going to say something?
Nope.
Okay. So first of all, when I talk to parents about colic, I like to distinguish between the Wessel's criteria and those babies that are fussy all day. If they're fussy all day, day in and day out, that's not colic. There's something else going on with those babies and they need investigation. But I think of colic as being like, I always tell my families, this is Dr. Jekyll and Mr. Hyde, where the baby's like, just crazy, crying, difficult to console, having a hard time, popping on and off the breast, not knowing what this baby wants. And then the baby goes to sleep and then wakes up and is like smiling and happy and, not, just acting like a normal baby. And so usually this will get better by about 3 months of age. The authors thought about this idea of looking at mom's diet because there have been a few studies that document improved colic symptoms when moms change their diets. And so they were wondering, well, maybe the way they're changing their diet is by reducing something called FODMAPs. And for those of us who are listening, for those of you who are listening who have never heard of a FODMAP, the FODMAP is actually an acronym for fermentable oligodimonosaccharides and polyols, which is why we call them FODMAPs, because no one wants to walk around saying those words.
I've been waiting this whole time to be like, what is that?
Yeah. So these are basically indigestible sugars and they cause gas. And so in my world as a family doctor, we are all about a low FODMAP diet because, primarily because irritable bowel syndrome is so common. So irritable bowel syndrome is, defined by people who have bloating and gas and, intermittent constipation, diarrhea. They're not regular. They're uncomfortable. And so the first step these days is to send them to the nutritionist who works in the GI department, who can counsel them on a low FODMAP diet. And low FODMAP diets are really tricky to do. And so I usually advise that families really get that patients really get counseling from the dietitian, because it's so, you look at the list of things that you can't eat and you think that you should never eat again. So
oh no,
it's really difficult. So what they did is they enlisted exclusively breastfeeding mothers whose infants were less than 9 weeks, who met the criteria for colic. So the way that they recruited is they used social media to find these moms. And in order to prove that they really did have colic, the mothers had to do a 7-day diary to document their degree of fussiness and crying, just to make sure they did meet Wessel's criteria. So they started out assessing 180 dyads, but they only found that 14 were eligible to participate. So, which is kind of amazing. So I don't know what all the, why it came out so low, because it seems to me that everyone in my practice has colic to some degree. What they did is they have 14 people. So they took 7 mothers in each group, and each group started with one diet. So one group started with a low FODMAP diet, and then switched to a regular Australian diet. The other group started
crossover
study, right? The other group started with the regular Australian diet and then switched to the low FODMAP diet. Now they didn't know, and they never heard the word FODMAP. They didn't know what low FODMAP was. They got their food from a van. The van came and said, "Here's what you're eating." Which maybe that's why they only had 14 people in the study, because when they found out that they had to eat out of a van.
Wait, can I just interrupt and offend all of our Australian listeners and be like, what is the regular Australian diet? Because I'm like, shrimp on the Barbie. Like, I have no idea.
Marmite? I don't know. I have no idea. I don't know. But it's, it's probably not like wasabi and, things that you find,
I have no idea. I haven't been to Australia.
Or eggs buried for 100 years is probably not that either. I have no idea.
If anyone would like to invite me to Australia to come and experience it, let me know.
Yeah. Well, I don't even know what a typical American diet is, other than going to like McDonald's, like hamburger, French fries, milkshake. That's a typical American diet, right?
Yeah.
Yeah. So, okay. So then they also had like a control group of mothers whose babies were under 9 weeks who didn't have colic, which to me, it's like, how do you find those babies? Because I hardly ever meet them. Anyway, so like garlic and onions are high FODMAP foods. And so the way that they trick them is they would use like garlic oil and onion oil, like flavoring, in order so that they could not tell the difference in the flavors of the foods. And so what they did, the findings were that crying went down by 20% with the typical Australian diet and about 32% on the low FODMAP diet. And so the thought was, well, why would this matter? Well, the first thing is that we know that low FODMAP diets will change the bacterial balance in the gut. So you know how we talk about how breast milk has oligosaccharides that feed bifidus bacteria, and so it encourages the growth. It's the prebiotic food for healthy bacteria. Well, FODMAPs, these indigestible sugars, will feed bacteria that are perhaps not the bacteria that we want to grow. Maybe it's feeding the bacteria that actually cause more gas and bloating, etc. And so the idea by putting moms on a low FODMAP diet is that you're changing their bacteria. And then there's this amazing research that has come up showing that there may be something called the gut mammary axis, where the bacteria that is populating the breast is actually coming at least partly from mom's gut to the breast through late pregnancy, and then throughout lactation through dendritic cells and through the lymphatic system. So there's some good research. I have a nice article that kind of looks at all the research showing that this is probably happening. So basically we're changing bacteria, and that bacteria that's kind of in this axis going from mom's gut to the breast is changing actively with low FODMAP diet. The other thing that's really interesting is that a lot of the foods that we talk about that mom eats and babies get gas, like cabbage and Brussels sprouts and cauliflower, are actually really high in FODMAPs. And we also know that food protein from any food. So we don't think of vegetables and fruit as being as having proteins, but every food has proteins, and those food proteins go into breast milk. And so then the question is, how much do the food proteins from these particular foods have an effect on the infant gut, knowing that those food proteins go into the breast milk? So it's an interesting start. I think my lesson in this is that if mom has irritable bowel syndrome, which is miserable to begin with, and then she has a baby who's screaming, which is doubly miserable, then she might reduce her misery overall if we advise her on a low FODMAP diet, have her meet with a dietitian, and see if changing her diet would help her, help not only herself and her baby. So I think, it's kind of low-hanging fruit, so to speak. I mean, I don't know if low-hanging fruit is only FODMAPs, but
I mean, between this and the babies that are infant proctocolitis and the moms aren't eating, cow's milk, soy,
right, exactly,
blah, 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 like they're eating air.
Yeah, but the low FODMAP diet, I mean, I think that if moms, I think I would suggest if mom has irritable bowel syndrome and she already has trouble with her gut, why not? I mean, it's good for her at some point to meet with a dietitian. It gives her something to start working on. And if the baby's really fussy, it might help her. But, she doesn't need to be on a milk, soy, protein, diet, elimination diet. If the baby's got colic, that, dropping dairy, I've never found to be helpful to help with colic. I mean, that's something that I think parents go to right away. And
it goes to that thing that you were saying about like, if babies are fussy all the time, then there's something else that needs to be investigated.
Yeah.
And I don't exactly understand why, if this were causing the baby's fussiness, that it would only be at that time of day.
Right. Well,
that doesn't make a lot of sense to me.
I know it doesn't, but the thing is that, there's strong evidence that giving Lactobacillus reuteri and then Bifidus infantis, there's not as much evidence, the eVivo product. There's a lot more evidence for like the Gerber Soothe drops with Lactobacillus reuteri on reducing colic. And it's the same thing where you're changing the gut flora, and that's actually helping colic just in the evening. So it's hard to know, it's hard to understand why that would work, but boy, that evidence is pretty strong. So, I don't know. But the good news about the whole thing, the good news is that colic only lasts for 3 months. And so I just say, what? It's a short time in your life. You can deal with this. Your baby's, not going to be fussy forever. And it doesn't have any association with like sociopathic behavior when they go to college or high school or whatever. So
I think crying is just something that all parents have to deal with, whether it's colic or not. And I think that it's the reason that you're like, everybody's struggling with this, is that it's hard. It's hard to hear your baby cry. And
it's
so
really hard. Yeah.
A lot of times, just even if we can't fix it, that like acknowledgement and that saying, this problem is going to get better makes a huge difference.
Having
absolutely. Providers that have been there and done that helps them so much.
Right. And knowing that things like taking out dairy or that there's not anything that they're doing that's necessarily causing this. Although I would add though that I have seen a couple babies lately who have been calmer and not as fussy in the evening when moms drop the amount of caffeine that they're drinking. So we haven't, there was a recent small systematic review that was published recently that said that if moms really have to have more than like 300 milligrams of caffeine a day for the baby to really be affected. But then you don't know how much caffeine is in coffee. And so I think if babies are really fussy, to really talk to moms to make sure that they're not taking a lot of stimulants, either caffeine, soda, coffee, tea. And then some of these other things like, there's all these beverages that are low in calorie that have like green tea extract and guarana, and all these are stimulants, might bother the baby as well.
I don't know. I find it harder to cope with crying or other life irritations without coffee. So
Yeah. Well, I did have one mother whose baby was just spitting up just huge amounts, huge amounts. And she cut back on, she was drinking a lot of caffeine because she was tired, because she was up a lot because the baby was fussy. And then that really helped immensely. So, so it's something to think about. I'm sure that there are many mothers who drink a lot of caffeine with the babies are not bothered at all, but it just probably depends on the baby. And then I did have, one mother who was using stimulants for ADD, and the baby was less fussy when she stopped the stimulants. So that's another thing to think about with fussiness. So, yeah. Well, I think we finished off that one. So, so for those of you who have not heard our podcast in a while, this podcast is produced by the former Milk Mob. Also now, well, our new name is the Institute for the Advancement of Breastfeeding and Lactation Education, and our website is lacted, lacted.org. And I want to mention that we have something very exciting coming up, which is going to be a free app called Lact Fact, LACT. FACT. It'll be free in your Play Store, and it'll just be a series of our clinical questions of the week, but just the actual 2-sentence facts with the article, so that if you're looking for a fact when you're at your family function about breastfeeding, and you can just find it in the app, search, find your fact, show it to everyone around the table, and the article. And you're a genius, and you can advance breastfeeding in our world. So, yes.
Excellent! I can't wait to download it.
Yeah. All right, Karen. Take care. We'll talk to you later.
Sounds good. Have a great day. Bye.
Bye. For questions regarding this podcast, please contact us through our website at lacted, lacted.org. We have other educational projects, including the Clinical Question of the Week, our Little Green Book of Breastfeeding Management for Physicians, and our various educational courses and conferences for physicians and other breastfeeding supporters. If you want to see what we look like, check out our Breastfeeding Medicine Podcast Facebook page, where you can post any questions or comments about our podcasts. Thanks for listening, and we'll be back with you in about 4 weeks.